intimately familiar with the military trauma system. I was catastrophically wounded on my 5th deployment, and the reason I'm alive is because of trauma surgery. Well, I was given a second chance at life.
Enter the world of military trauma surgery with Frontline Surgery, where we bring you expert insights and real-world scenarios to help surgeons stay ready.
Brought to you by the AAST Military Committee. Join us as we engage in conversations with field experts, examine critical battlefield scenarios, and uncover the strategies that keep surgeons ready for anything.
Stay prepared and stay sharp with Frontline Surgery, where every episode provides key insights into mastering military trauma care. Welcome to Frontline Surgery, Mastering Military Trauma Care. I'm Joshua Dilday, and I'm joined by a host of military trauma experts that serve as co-moderators for this, our kickoff, our initial episode, and what we hope to be a wonderful podcast dedicated to empowering future trauma leaders in the realm of military trauma care. These experts that have joined me today, they've led this initiative through the AAST and into fruition, and I'm so excited that we can launch them all present on this episode. And we'll start by letting them introduce themselves. We'll start with Colonel Jennifer Gurney.
Yeah, thanks, Joshua. It's an absolute honor to be doing this. My name's Jennifer Gurney. I'm an Army general surgeon and trauma surgeon, and I'm currently the chief of the Joint Trauma System.
I'm Matt Eckert, co-host with Josh in this very important podcast series and a retired Army trauma surgeon.
Yeah, I'm Matt Martin. I'm the division chief of trauma and acute care surgery at Los Angeles General Medical Center, USC, retired Army trauma surgeon.
Hi, I'm Jay Yellen. I am a Navy trauma surgeon, currently assigned to 1st Medical Battalion, Camp Pendleton, California. And I am privileged enough to work with these folks as the chair of the AAST Military Liaison Committee. Thanks, Josh.
Well, thank you all. Now, this podcast series was created to empower early career military surgeons with the knowledge, the context, the mindset needed to succeed in deployed trauma care. Every episode is grounded in real-world operational experience, tactical challenges, and most importantly, the people who live them. Our goal with this podcast is to help surgeons feel more prepared, more confident, and more connected to the greater mission of military medicine, specifically military deployed trauma care. Now, to kick off the series, we're starting with the most important question, the why behind combat casualty care. Why do we leave our homes and our hospitals to provide life-saving care in tents, in trucks, and ships, and trauma bays halfway around the world? Why is mastering military trauma care essential in today's day and age? And today's guest has lived the answer to that question. And his story embodies the purpose and the inspiration behind this very podcast, behind Frontline Surgery. We're pleased and honored and humbled to be in the presence and have Oliver Campbell join us today. Oliver, thank you so much for joining us. Please introduce yourself to the audience because we are so excited to hear your story today.
Thank you all for having me. I'm really excited to talk to you all about my experience. Intimately familiar with the military trauma system. I joined the Army after high school in 2011, and in 2016 in Afghanistan, I was catastrophically wounded on my 5th deployment, and the reason I'm alive is because of trauma surgery and the immense dedication and talent that you guys all have.
Well, Oliver, thanks again for joining us. It really means a lot to have you here to help us understand and explain the why of this series. In this podcast series, we begin each episode with a clinical or tactical clinical scenario to sort of paint the picture for our guests. And this one's a little unique because that scenario is your lived experience. And we really appreciate you sharing that with us as much as you're able. So if you wouldn't mind, could you walk us through the events that led up to your injury and your introduction to the military medical system and that chain of care that you experienced?
My 5th deployment, it was winter of 2016, and we were going after a high-value target in a pretty remote region of Afghanistan. It took 2.5 hours on helicopters to get to the target, and so we landed about 400 meters from the objective, ran up to the compound wall, got it isolated, and initiated a call out to try and get the people out peacefully without any violence or harm to civilians. About 5 minutes went by and there was no response from the compound. And then a gunshot went off. And at this point, I was like 5 to 10 feet from the compound wall. And the gunshot sounded like it went right past me. I started looking around for where it might have come from. And then a couple of seconds later, I was shot. Knocked me on the ground. I remember kind of coming to and looking up at the sky and wondering what the heck just happened to me. Felt like I got hit with a sledgehammer in the chest. That's the way I describe it. So I rolled over, stood up, and walked over to my boss at this point, my platoon sergeant. At this point, I was thinking that I probably got shot in the body armor. So it just felt like a massive impact. And so I go to the platoon sergeant. I was like, hey, I think I got shot in the plates. He was like, okay, let's get you checked out. Then I heard this like gurgling sound in my right ear, and there was just blood pouring down my right arm. It turns out I had been shot twice in the upper left chest, once above the right clavicle and once the outside of the right shoulder. Yeah, one of the gunshots to the chest fractured, or likely fractured on a rib, and just sent bullet fragments throughout the left lung. And then the other bullet to the upper left chest kind of arced over my heart and I don't know, either lacerated or transected the left inferior pulmonary vein. And those were the injuries causing major damage. First thing we did, we got to a kind of a covered position, pulled off the objective a bit, and then the medics went to work and in their basic care and rapidly kind of like undressed me and put occlusive dressings over the chest wounds and then packed the shoulder wounds. And it was probably within a minute I developed this crushing sensation in my chest. It felt like it was being crushed from the inside. And I couldn't breathe. And then they did a needle thoracostomy and immediately felt a million times better. And yeah, continued to kind of assess my wounds. The medics began to reconstitute freeze-dried plasma. One thing they did was they did the initial swirling and then passed it off to another infantry guy who was there, and they were inserting IVs. This is, again, all at night, which kind of speaks to how skilled these guys are. And inserted IVs, and they kind of delegated other tasks medically to the infantry guys. One of the guys I went to my assessment and selection with, he was an infantry guy. He was putting in needle thoracostomies while the medics did other things. And yeah, within a few minutes, I was starting to get pretty lethargic. And they were kind of having to shake me to keep me awake. I remember being nervous at that point, but still with it enough to figure that if I joked around with the medics and stayed calm, that maybe they would be less anxious and perform better. It was kind of like a weird survival mechanism in that moment. So I was like making jokes, and they seemed a lot more concerned than I was. I can't remember how long it was. 5 to 10 minutes after I was shot, I think I had like a dozen needle thoracostomies across my chest, looking like a human dartboard. The medevac helicopter came in, and they tried transporting me on a stretcher, but the terrain was pretty bad. They dropped me, stretcher broke. I remember being rolled off of it, and they were trying to fix it. And after about 20 seconds, I just said, screw it. I really wanted to get at it. And so, yeah, 2 guys helped me walk to the helicopter. At that moment, I was coughing up blood and thinking to myself, like, this is the part in the movies where the guy dies. So, yeah, it was like this sensation of kind of like impending doom. But staggered to the medevac helicopter, collapsed on it. I was still lucid at this point. The flight medics, all I remember is they put an IO into my sternum. which felt nice. That was pretty painful. That was probably the worst part of that whole thing. Put an IO into my sternum, and I remember them reading my blood pressure off as 85/50, and they said, "This guy doesn't look good." I was thinking to myself, I go, "Oh, thanks. Exactly what I want to hear right now." But in that moment, I kind of became very aware of the reality that I might die. And it gave me, I guess, a chance to think of my family and reflect on my life, even if it was very brief. The thoughts that went through my head is I wanted someone to tell my parents and my sister that I loved them. And I just hoped that I had been a good person. And then, yeah, on that same helicopter flight, I kind of like shook that off and was determined to make it out of there alive. Yeah, that flight was only about 2 or 3 minutes long, I think. It was just to get to a safe location where they could transfer me to a different medevac helicopter that had a trauma surgeon and anesthesiologist on it, and kind of use the last ounce of my strength to get up and walk over that. I guess from what I've told, we were being shot at by a machine gun on a mountainside at the time. I didn't remember that, but kind of collapsed on that second helicopter, and the trauma surgeon went to work. I think in the case report, he described me as like pale, ashen, and like lethargic. Yeah, I could barely answer the questions of like where I was from, what year it was, circling the drain. You could tell I had these devastating injuries that were to the left side of my chest, and I think it was red light or maybe white light on the helicopter at that point. Put chest tubes into each side of my chest. Over 2 liters of blood came out of the left side, and about 400 milliliters came out of the right side. And so that was kind of the decision point. Do you transfuse since you're on a helicopter and try to make it to the surgical team on the airplane that was staged? I don't know how far it was, but do you transfuse or do you do surgery on the helicopter? And he chose to do the thoracotomy on the helicopter. Yeah. Upon administration of the anesthesia, it stopped my heart, which he had kind of planned for. He, the left-sided thoracotomy, and he said he did a hilar twist, opened the pericardium, somehow identified that it was the left inferior pulmonary vein that was injured. He corrected that. I don't know if he ligated it or what, but stopped the bleeding, and at the same time, the anesthesiologist was kind of just mashing blood into me, and the trauma surgeon did a cardiac massage until I guess my heart started to flicker, and he gave it a couple of flicks with his finger, and it got going again. And yeah, they got me to the surgical team on the C-130 that was kind of forward staged, and I think I arrested on the C-130 as well, on the flight back to the main hospital and theater. But they were able to again do a cardiac massage and get it going again. And yeah, at the main hospital out there in Afghanistan, they further resuscitated me, did an X-lap, and I thought there was a diaphragm injury, and stabilized me enough to get me to Germany a few days later.
Oliver, thank you for sharing that. It's incredibly impactful for all of us who've done that operation and have but to see someone like you talk about this is just amazing. So thank you for sharing. My first question is, what would you say to the medics, the guys that are worried about some of these scenarios for the future? What was the most impactful thing that besides saving your life, but what your experience, the kind of non-medical interventions that you had? You obviously remember the things they said, but what would you say to those guys is super important for patients like you to hear in their, most desperate time of need?
I think there were a couple of important things during that. Like, I pull up, there are many important things that happened during my casualty care. I think from just the basic proficiency of the general infantry guy in my unit, to be proficient enough to do needle thoracostomies. We're all trained to put occlusive dressings over chest wounds and needle thoracostomies and tourniquets on extremities. Just the basics, and we drilled them, and that sort of thing paid off because it freed up the medics that night to work on other interventions. So I think that was really important. And then on top of that, for the non-medical stuff, that night, I remember the medics working on me before getting to the helicopters. They were kind of keeping things composed, and they're saying, like, you're going to be all right. We got things under control, threats eliminated, things are going to be okay. And in that moment, it was reassuring. Kind of juxtapose that situation on the helicopter where I said, this guy doesn't look good, which I think now I kind of appreciate that. It's kind of a philosophical thing, but it gave me the chance to think of my loved ones. If I had passed away in the afterlife, if there is one, I would have been grateful for a chance to remember my loved ones.
I mean, that's a heart-wrenching story. So what's the next thing you remember in your trip through the casualty care system? Do you remember? Did you wake up and you were in Afghanistan, or were you back in Germany or the U.S.? And then just real briefly, kind of the rest of your hospital course, and how long you were in, and when you got discharged home.
So the next thing I remember, it was like a black hole between being on that second helicopter, and the next thing I remember is waking up in the hospital in Afghanistan. And I was intubated. I remember trying to figure out how to breathe and realizing you just got to let it breathe for you. And I was pretty out of it. But I woke up twice. I think it was like 8 hours later the first time, and then I don't know how much longer the second time. Presented with the Purple Heart and visited by a bunch of friends. But I think within 2 or 3 days, I was on a medevac plane to Germany. I stayed for, it was 4 days in Germany, where I remember being so weak I couldn't get out of bed for the first few days. I had all these tubes running in and out of me, and I was in a lot of pain and discomfort. One thing I'm grateful for during that time was they coerced me to get up out of bed, and I think it was day 4 after being wounded. I said, you got to get out of bed. And I was at like my peak physical shape at this point, prior to being wounded, and looked at the task of getting out of bed as the hardest thing I would ever do. But I'm glad I did it. I felt a million times better. Visited me at the hospital, and I got to walk around a bit. From there, I was transported to Walter Reed, and I spent 5 days there. That's when like some rehab started as well. So just kind of became more and more active. I had some friends and family visit. Saw my dad and sister. And from there, I was transported back to Madigan at JBLM and spent 3 days there. So I think it was like 16 days in total from being injured to getting out of the hospital. Yeah, one really important thing that happened during that time, or at least at the end, that's had a lasting impact. And this is like an oddly specific thing, but it's kind of on my mind, is these injuries and war come with a lot of pain, and that pain was tolerable while hospitalized. There was IV Dilaudid. At the very end of my time in the hospital, I had this anesthesiologist come to me and counsel me for about 15 minutes. I think he went out of his way to do it too. And he gave me this kind of fatherly and somewhat esoteric talk about addiction and pain management. But yeah, the principle was like these, it's not something to be taken lightly. It can ruin your life or significantly change your life if you do get addicted. Just handle it with care, use it with care. And so, yeah, I was discharged with, I think it was like 15 or 30 days worth of Oxy. And for the first 48 hours, that conversation was on my mind until I was in the worst pain of my life. And so I started using the Oxy, and I used the 30-day prescription of it. And at the end, I felt some craving or desire for more, because it gives you a pleasurable feeling. But that conversation was still on my mind, and I had one refill and chose not to refill it. And I often wonder if things would have been different if I hadn't had that conversation. I got that refill. So there's a little thing to be mindful of.
Oliver, first of all, thank you for sharing that story with us. It is truly humbling. The surgeons on this panel and the surgeons listening to this do what you described all the time. Sometimes we get a brief look at how things go, but just your insights really are touching. And so I first of all want to thank you for sharing that with us. Let me turn the dial back a little bit and get into your mind as a warfighter. How does knowing that you have a team of trauma experts behind you influence your ability to carry out the mission?
I think my perspective before I was injured and after were obviously very different. I think the perspective of the medics in the field would be a lot more impactful. In doing that job, I don't know if it's a coping mechanism, but the guy running around amidst, bombs and gunfire, you'd think like nothing bad is going to happen to me. Someone else might get hurt, but I'll probably be fine. And so, on a personal level, I guess we thought that bad things wouldn't happen to us. But as I've seen both sides of almost all perspectives at this point, it's a special thing to have like the amount of resources and the training that's required to care for wartime injuries, and especially in forward positions, pushing surgeons out to the very close periphery of the battlefield. One, it's brave of them, it's heroic, and two, it's a massive resource. It takes a huge burden off of medics, and probably alleviates some of their worries. And it's just a special thing to have that amount of resources dedicated to caring for the injured soldier.
You never think you're going to be the patient, right? And so you fortuitously are the recipient of expert care. Honestly, that's expert care that you received at every step of your injury care. I wonder if I pose that same question to your teammates that were standing by your side, who were caring for you as they executed missions in the future, they may have a different perspective. But I think you summed it up beautifully, understanding the amount of expertise, knowledge, and resources that are required to care for someone as massively injured as you are at the point of injury is really a special attribute. So thanks for sharing with us.
Oliver, your story is nothing short of amazing. You were part of a very special unit that trained to a very high standard, obviously. And some of those things that you recounted really reflect upon the people that practiced and trained to a very different level. And we know that, unfortunately, that doesn't happen everywhere in the military medical system. You were very fortunate that day. This podcast is designed to educate the next generation of surgeons, the ones in training now, the future ones that don't get a chance to, for good or bad, see that combat experience and sort of shape them early on in their career. It could happen tomorrow. It could happen 10 years into practice. Who knows? Do you have any advice for them as they're going about their training and forming their early career practices?
And I think going into any new scenario, everything's kind of theoretical before you actually experience anything, which is a difficult thing to prepare for. But yeah, it's kind of the purpose of things like basic training or things like intermittent practice of, at the infantryman level of basic trauma care in the field. And then, we'd have scenarios, we would practice scenarios of mass cal events. And we got to hear perspectives of people who had been there. And I think the combination of those things, it was so valuable to everyone at every level of care. And so I think things like Dr. Martin, I read a few chapters of your book last time I was on the call over there. The whole purpose of it was to kind of take a bunch of pass-ons and lessons learned and combine them into one book and one resource to help future military surgeons and medical professionals and logisticians. So I think it's just the combination of learning from past cases, practicing and preparing for future events and scenarios that might come up. And then on top of that, I have heard that pushing surgeons out onto the battlefield was kind of a new innovation, newer when I was injured. And I sometimes think like if it had been 10 years prior, I wouldn't be alive. And I heard about another case, I think it was a couple of years after I got wounded. A guy from same regiment as me was shot in the pelvis and arm during a heavy firefight. 20 enemies within 150 meters or something. And so medevac, possibility of medevac was at the door. But at that point, they had developed man-to-man transfusions, and I think they did like 8 to 12 in the field or something, enough to resuscitate and sustain this guy until they cleared the firefight and evacuated him to surgical care. And if that had happened a couple of years prior to that innovation, he wouldn't be around, or he might not be around. And so I think it's speaks to the importance of, humbly from just a med student perspective, speaks to the importance of like innovation and innovation in military care.
Well, Oliver, you just hit something that I kind of want to hear your perspective on. You obviously were the recipient of innovative frontline care. You just mentioned some more innovation in frontline care. And then you just dropped this nugget about a med student. Can you tell us what you're doing now and where you're at? And does your prior experience maybe have some sort of influence on what you're doing?
Just a little bit. I had no intention to pursue a career in medicine prior to being wounded. And it was like 6 months, I think, after I was wounded. I was kind of reflecting on things and kind of out of that acute stage of recovery, and just came to this realization of how profound and special it was to essentially be I was given a second chance at life. And I figured, I could, getting a little choked up here, I figured I would be satisfied with my life if I could give that same second chance to someone else, because of the impact it had on not just me, but my family. And it's, so I'm currently a third-year medical student at UCLA, and I will be applying to general surgery residencies next year. Probably I'll give a careful look into going into trauma surgery, but keep an open mind.
And we've already started the recruiting battle.
We did.
Yeah, Oliver. I mean, it sounds like you saw the firsthand front lines. It sounds like you're now speaking that, hey, maybe you want to give back on the front lines, and for that we are humbled to even be able to listen to your story. I think your story captivates everyone on this call. It captivates the entire audience for a variety of reasons. It epitomizes the human aspect of why teams like that do what they do, but also it shows the importance of exactly why the training matters, why the education matters, because you're living proof of that. And by no means are we taking for granted the opportunity that we're able to sit here with you and speak about this today. Thank you so much. And for everyone, thank you so much for joining us on Frontline Surgery Mastered in Military Trauma Care. Today's conversation reminds us that this work is not just about procedures or protocols. It's about the people embodied right here by our inaugural guest of honor. And it talks about the purpose and the preparation so that stories like this can live on, not just be remembered, but actually duplicated and replicated as we continue on with the mission. And as listeners, as you listen to future episodes, we hope you carry this sense of why with you. We hope that this story resonates at the deepest level. And until that next time, stay sharp, stay ready.
Thank you for tuning into this episode of Frontline Surgery. We hope today's discussion has provided valuable insights into military trauma care.
Be sure to join us next time for more expert perspectives and battlefield-ready knowledge. Until then, stay ready.